Hi, I'm Harriet McMillan. I'm a pediatrician and child psychiatrist from the Offord Centre for Child Studies at McMaster University in Hamilton, Ontario, Canada. And I've been asked to address the question, what is intimate partner violence? Intimate partner violence, which some people also refer to as domestic violence, is a major public health problem. The term includes the major types of abuse, which are physical, sexual, and emotional or psychological abuse by a current or former partner or spouse. The next issue that comes up is, what does it mean when we talk about exposure to intimate partner violence? For example, exposure to violence experienced by children. And even though we don't have a uniform definition for partner violence, exposure to intimate partner violence by children includes seeing, hearing, being directly involved in the violence. For example, sometimes children try and prevent a caregiver or parent from being hurt. So all of that is included in the phrase exposure to intimate partner violence, as is exposure to any of what we call the aftermath of violence. So for example, if a child sees a parent who has injuries from having violence committed against them, that's also considered exposure to intimate partner violence. In the past, people used to focus on witnessing, but recent research shows that it's not just seeing the actual violence that is a major problem for children. It's also hearing about it or seeing the effects of violence when their caregivers experience it. Okay?
Go.
Some people ask, what kinds of behaviors are included in the concept of psychological or emotional abuse? And certainly the types of behaviors that most people think of are someone deliberately humiliating another person, but we also need to appreciate that other types of behaviors, such as trying to control where someone goes, who they see, these types of behaviors are also considered within the definition of psychological or emotional abuse. Isolating someone from their family and friends is another type. Something that many people have heard about is stalking, which involves a type of harassment. So an individual showing up at a person's workplace without the person wanting them there, or showing up at their home, sending them messages, sending them objects. Really, it's the kind of behavior through words, gestures, threats that is a type of abuse or is otherwise potentially harmful to individuals. Those are the types of behaviors that are considered within the realm of psychological or emotional abuse. I would just add that in fact the U.S. Centers for Disease Control and Prevention includes 4 major categories of intimate partner violence. So they think of IPV, which is the short form for intimate partner violence, as being divided into physical violence, sexual violence, threats of sexual and physical violence, and emotional or psychological violence. So they actually separate out the concept of threats of violence into a separate category, where other systems of classification include that within the psychological, emotional category. We know that there is about a 30 to 60% overlap among children who are exposed to intimate partner violence with other types of maltreatment, so that those who experience intimate partner violence are also at risk for other types of maltreatment and vice versa. So what are the types of impairment we see among children exposed to intimate partner violence? They experience greater risk of emotional, behavioral, and social problems, particularly post-traumatic stress disorder symptoms or the disorder itself, as well as depression, anxiety, anger, hostility, low self-esteem, and we group these kinds of problems into what we call internalizing kinds of conditions. So that would include, for example, the anxious and depressive problems, and externalizing problems, which would include issues, for example, such as oppositional behavior and the term conduct disorder. So in addition to those behavioral and emotional problems, we know that children exposed to intimate partner violence are more at risk for social problems. For example, getting along with their peers and siblings, for example. The second major category of difficulties experienced by children exposed to intimate partner violence include cognitive problems. So we know that these children have more difficulties at school, more problems with academic achievement. And then the third category has to do with long-term problems. So we know that those exposed to intimate partner violence in childhood are more likely to have mental health problems in adulthood, particularly post-traumatic stress disorder symptoms and depressive kinds of conditions, and other sorts of difficulties, including increased risk for drug and alcohol use. We also know that children exposed to intimate partner violence as they grow up are more at risk for other types of victimization, so to be exposed to partner violence in their adult relationships, and are more at risk for committing intimate partner violence. So these are the three main categories of many kinds of difficulties experienced by children exposed to partner violence. It's important to note that not every child exposed to partner violence goes on to have serious maladjustment. Some don't. But perhaps some that don't have major difficulties are at risk for taking on attitudes that could be problematic in their future relationships. For example, perhaps children exposed to partner violence are more likely to think of violence as an approach to resolving conflict, or they may blame themselves for the violence between the parents that they were exposed to. So these, again, are the kinds of issues to keep in mind. Not every child who experiences violence goes on to have difficulties, but certainly they're at greater risk for the kinds of problems I have outlined here. Thank you.